thinking about school nursing, thinking it's going to be a breeze. The majority of it is, but there's a few things that you need to know before you enter into school nursing. This is for you new grads, you mid-level grads, and you senior grads that are trying to exit bedside nursing. So, number one, you're going to be up against faculty. Faculty is the majority of the school, and they believe that they can tell you how to do nursing and how to take care of patients. You need to stand your ground, and you need to use your AMPI process. Be a little assertive, polite, professional, and let them know that you have a job to do. Number two, the medication card that has to be signed by the parent. Sometimes you're going to work with a clerk or an assistant. And because she's been there so long, she's going to believe that just because she keeps up with the records, that every time a student comes in and they ask for medication, that she could just tell you it's okay to give. I'm here to tell you, you're a nurse. Follow your 5 rights of medication. Excuse me, may I see the medication card, please? Look at the medication card. Make sure that it says what the doctor ordered. Make sure that there is a yes checked off, that the parent said that the student can have it, because it's going to be the student at risk and your license at risk if you just take her word. Remember, you are the licensed clinician, and you're going to have to stand your ground and reinforce that. Number 3, the nursing office is supposed to be just for the nurse to take care of students. Well, guess what? The majority of the building has keys to the nursing office in some school districts. And what you will need to do is, when people come in, you're going to document who comes in, what time they come in. You're going to ask politely, may I help you? My name is Audra. I'm here to fill the school nurse position today, or I am the new nurse. Do not let them go into medication cabinets. Make sure the cabinets are locked. Do not let them go into drawers and just get any supplies. Do not let them go into the exam room, okay? You are going to ensure that all medication cabinets are locked, that you have the main key to those medication cabinets, and that you are not allowing access to any of the students' records. Once again, you are there as the licensed clinician to protect the students' records. Even teachers don't have access to the student record, although they are going to try to persuade you and test you. Can you pull up Bobby Jones' record for me? He's saying that he's feeling a little wheezy. That's not what you're going to do. Okay, well, would you like to bring Bobby down so I could take a look at him? Then you look at the records. So those records are going to be in a locked cabinet. You have the key. You're to make sure they are locked, okay? But because a lot of the staff have keys to the nursing office and they're not supposed to, you want to document that, because that way, if anything gets missing, if anybody, oversteps their bounds or steps out of scope as a teacher or a janitor or a security guard who has been coerced or forced to give medication in the nurse's absence, has gone and given medications without being licensed, and something happens, you have an adverse action to medication, you will not get blamed for that, because you will have documented who comes and goes and that they have keys, okay? Do not try to fight, the fact that they are not allowed to come in. You're going to be viewed as a target. They're going to try to get rid of you. Number 4, when you come into the nursing office each day, what you want to do is you want to look at the folder of standing orders. You want to go over your standing orders. You want to make sure that you go through the students' MAR, to make sure you know what students have meds for today. And you want to read over the policies and procedures and find out where you're going to document. Are you documenting on paper? Do you have access to the school system? If you're a certified school nurse and you're the new nurse, you're going to have access to the computer school system. If you're a fill-in nurse like what I do, sometimes you're going to probably document on paper. Nevertheless, you can jot down a couple of their policies and procedures on paper, who you're working with throughout the day, who you received keys from, who you gave keys back to. So that way you have a record to look back on, if anything happens down the line. Number 5, and in closing, school nursing sounds like it's going to just be easy breezy. Let me tell you something. It's like a little triage. It's like a mini triage. I literally took care of approximately 26 students yesterday. And yes, you're going to have your students with chronic asthma, and you're going to have your students with seizures. Remember, with your seizure, you're going to get them safe. If they're on the ground already, you're going to turn them to the recovery position on the left side, let them seize. Timing is of the essence. If you go over 2 minutes, you probably have a seizure protocol there where you're going to give, Ativan or something like that. With your asthma protocol, these are things that you're going to check when you first come in. That's why the MAR is very important, because you're going to see your asthma protocol. You're going to know which students have asthma. Another good key, and I always drop a gem. Most students come to the nursing office just to get out of class. So you can ask that assistant, who are the frequent flyers, and you jot down a list of frequent flyers. So that way you're not exhausting unnecessary time, that you could be spending on a student who really needs your help, on a student who's just trying to get out of class. Happy school nursing.